So my lab, in collaboration with two other labs, recently got funding from the Office of the Provost to pursue the development of a diagnostic device that is electrochemical in nature. So we're not consulting, but we are doing active research on developing this diagnostic platform for the disease. We're in very early stages, but there's a pressing need, as I am sure you know, develop diagnostic devices that are highly specific and sensitive that would give us, on one hand, tools to be able to diagnose people who are infected with the SARS-CoV-2 virus, as well as using those platforms to determine whether certain people are qualified to go back to work or not based on their immune responses or state of infection. These are things that we hear in the news. They're actually very complicated to implement, and some of them may be seen as authoritarian. But from the point of view of science, just having the tools to be able to monitor population spread of the virus becomes a very important scientific tool to better understand epidemiology, as well as, to make educated decisions based on the level of or the extent of infection spread, and decide who can go back to work or not. So it is an important scientific problem, and I think potentially could provide a pragmatic solution to that difficult decision that, for example, we're seeing in Germany, right? The Germans are deploying all of these tests. They're using the testing as a means to probe whether people should go back or not, and they are having really good results so far.